Hello there, my name is Jackie Whitus and I am an occupational therapy student with the American Stroke Foundation. Today we will be discussing sex and sexuality after a stroke. During this time, we will explore what sexuality is, some facts about sex after a stroke, reasons people like you yourself might avoid or feel unable to participate in sex after a stroke, and ways to overcome these barriers. In occupational therapy, sexuality is included as an activity of daily living, which are known as activities one does to take care of their own body, just like toileting or feeding and dressing oneself. Sexual activities themselves can be defined as any activities that result in sexual satisfaction or meet relational or reproductive needs. With these two definitions in mind, it is understandable how returning to sexuality and one's sexual expression can be just as important of a goal as that of taking a shower or taking care of one's personal hygiene independently after a stroke. For many stroke survivors, there can be a lot of unknowns when it comes to beginning sexual rehabilitation. Research has shown that 94% of stroke survivors experience some impact on their sexual activities due to their stroke, and that over 70% of stroke survivors wish that they had received information on sex after their stroke, whether as a conversation with their doctor or rehab team, or simply a pamphlet to provide them some education. This information is glossed over sometimes in the acute and subacute phase of stroke due to health professionals and your own priorities in rehab to be on returning to other activities of daily living before covering sexual rehabilitation. We will discuss this more later in the presentation. Finally, some people have a fear of having another stroke while having sex, but research has shown that the risk is very low, as having sex is typically no more strenuous than going up a couple of flights of stairs. Now that we know a little bit more about sexuality and its role after a stroke, we will discuss how to handle some common problems you or your partner might experience when you try to engage in sexual activities. We'll cover aphasia, partner fear and role changes, decreased mobility and energy, and communicating with health professionals, and offer some solutions you can utilize yourself. The first barrier we'll cover is that of aphasia. Communication during sex can be important, and if you're unable to communicate clearly, you might not want to try to have sex. If this is something you are experiencing, one way to overcome this is to come up with nonverbals for you and your partner to use. These can be as simple as a head nod or a hand squeeze to say yes or no. Make sure both partners know these signals and can do them easily during sexual activities. Use these signals regularly throughout and make sure to check in with each other more often during sex. In addition to aphasia, after a stroke, there can be role changes. Instead of having your relationship roles be that of a married couple, you might now feel like your main role is that of a caregiver or a stroke survivor. If this is occurring, you and your partner might need to go back to the basics in your relationship. Focus on the intimacy of being in a relationship through hugging, kissing, or cuddling, then work up to other activities as you wish to. Or you and your partner can explore your love languages. Love does not have to be expressed in one way, and this easy quiz might help you learn how else you and your partner show your love. A link to this quiz will be in the description box down below. Another problem you might be encountering as a caregiver is a fear of hurting your partner. If this is the case, communication and preparation beforehand will be helpful. Learn what positions feel most comfortable and the least painful, and check in regularly throughout sex to see if anything needs to change. Another common change after a stroke is that of decreased mobility and energy. You might feel unable to perform the way you used to, or not even have the energy to do so. If mobility is an issue for you, two easy solutions are to have the more mobile partner be on top and to use pillows to prop you or your partner up as needed. If energy is a main concern for you, scheduling sex might be a good solution. Do whatever you need to do beforehand to make yourself comfortable. Go to the bathroom, take a shower, make sure no one is going to bother you. Then when it's just the two of you, take your time and go at your own pace. It doesn't have to be a sprint to the finish line. Lastly, a common problem experienced by many stroke survivors is that this topic simply is not talked about by health professionals during rehabilitation. As stated earlier, for some they might have other rehab goals first. But if you're finding that this is something you want to know more about, prepare some questions to ask your doctor, whether it's a question about medications or something else. Write them out or bring your partner with you to help you ask and remember everything you learn. If you are still experiencing major barriers to resuming sexual activities, you can be referred to other professionals who specialize in the field of sexuality. We've gone over a few different barriers and solutions to engaging in sexual activities after a stroke. Communication is important, and setting expectations for this communication beforehand can be helpful. A focus on intimacy over sex can be a good starting step for those struggling with role changes to caregiver or stroke survivor. When engaging in sexual activity, be willing to adapt your body's abilities and energy and set time aside to explore these abilities with your partner, or even on your own. And finally, if you have more questions, reach out to your doctor to learn more. Your doctor can also talk to you about birth control and protection to prevent pregnancy and sexually transmitted infections. Pregnancies for stroke survivors are considered high risk, so your doctor can answer more questions if this is a priority for you. The following are some resources that were utilized to create this video, and you can also explore them to learn more about sex and sexuality after a stroke. Thank you for listening, and I hope you found the information presented to be both useful and applicable to your own life and experiences.